Well, every year, thousands of people dealing with arthritis have total shoulder replacement surgery. Well, sometimes that standard option just won't cut it. And that is when we turn to Dr. Scott Stevens. He's an orthopedic shoulder surgeon with Ortho Neuro. So good to have you, doctor.
Yeah, thanks for having me. It's great.
Let's start with a little explanation first. Shoulder arthritis, is it just kind of a standard thing? Are there different types of it that we need to know about?
You're exactly right. There is multiple different types. So when we think about the shoulder, we think of the long bone, the humerus, the collarbone, the clavicle, the scapular shoulder blade. When the long bone and the scapula come together, it's a ball and socket joint. When that thin cartilage cap erodes away and the underlying bone is exposed, that's generically known as arthritis. There's multiple different types. We have generic wear and tear known as osteoarthritis. We have, if you have a specific injury to that shoulder, post-traumatic arthritis. Sometimes we have autoimmune disorders such as inflammatory arthritis. And we have a specific type of arthritis known as rotator cuff tear arthritis when we have associated rotator cuff tendon tears with arthritis.
And I feel like a lot of times when we hear anything about the rotator cuff, we automatically assume it's like a pro athlete.
Right.
You know, athletes get that kind of injury often, but it's not just that. I mean, people every day, as you're saying, deal with that and deal with arthritis in that area. So what exactly, are there symptoms and signs and things we should kind of look out for?
Yeah, you're exactly right. You know, we really see an entire age range from young athletes to most commonly my patients are actually older who are the weekend warriors who still want to remain active. The symptoms that most commonly brings them in is they'll have pain, specifically pain at night. When they're rolling over at night and they keep turning from side to side, that's the #1 complaint I have. When you have a tendon tear, you have weakness associated with it, so you have the pain as well as weakness. You have loss of motion and some what we call mechanical symptoms or cracking and popping of the shoulder joint.
And I mentioned, you know, in the intro saying a total shoulder replacement, but you do something called a reverse total shoulder replacement.
Exactly right. So, you know, unlike knees and hips, the shoulders actually have two different types of implants. If your rotator cuff tendon's torn, you've lost the balance of the shoulder. When you lose that balance, you no longer have the function. What studies have shown is that when you try to mimic the normal anatomy by putting in a conventional total shoulder replacement, you don't get the function back, and over time it can loosen. So in the 1980s, the Europeans actually came up with a genius idea. They actually reverse the anatomy by putting the ball and socket on opposite sides. What that does is help stabilize the shoulder. It mimics the normal function of the rotator cuff and allows the deltoid muscle to work more effectively. So it restores pain-free motion. It does a phenomenal job doing it.
Yeah, so is that kind of what we're seeing on this model? Can you point us out like what the difference is here?
You're exactly right. So the first sign or implant we have right here is what we call the conventional or anatomic implant. It simply replaces the ball with metal and the socket with plastic. Now, if your rotator cuff tendons are intact and all the ligaments are intact, it functions great. The problem is if one of those rotator cuff tendons are torn and you've lost the balance of your shoulder, you lose that range of motion. Unlike the knees and the hips are fairly constrained, the shoulder has the most range of motion of any joint in their body. It comes with a caveat being that if the tendons are torn, you don't have that function come back with a shoulder replacement. So we've designed what we call the reverse total shoulder replacement. And very simply is it puts the socket on this side and the ball on this side. And what that does is that constrains the shoulder and allows it to replace the function lost when the rotator cuff is torn and the deltoid muscle to work more effectively.
Now, is that only for certain candidates? I mean, does some work better for others, the standard versus the reverse?
Exactly right. If all your tendons are in place and all the ligaments and you have a nice stable shoulder, the anatomic conventional shoulder still gets phenomenal results. For patients who don't have that, then the reverse total shoulders for patients who have torn tendons, specifically rotator cuff tendons. Sometimes patients undergoing revision surgeries or patients who have a significant amount of bone loss is when we consider doing the reverse total shoulder.
And as far as results, I mean, you mentioned it can be phenomenal. So are they having almost pain-free, or is there still some opportunity for that to kind of bother them as they go on?
You know, most people that come to me, they have such a loss of function, they can't lift their arm above their waist. And so by putting the shoulder replacement in, they can actually lift their arm above their head again. It's a life changer for some people who want to return to an active lifestyle. And pain-free is the #1 goal we have. But if you can return function and restore motion, just be able to comb your hair, it's a life changer for people.
I could imagine. Doing those simple things that we take for granted is something they want to get back. So the surgery pretty straightforward as far as that recovery. How long are you looking at?
Yeah, you know, so really one of the amazing things in medicine nowadays is I think pain control and hospital stays have really improved. You know, patients are in the hospital for a day. We leave them in a sling for about 6 weeks afterwards, but we get therapy started after a couple weeks. You know, it's so stable nowadays that we let people start moving after a few weeks. Within 3 months, people notice a dramatic difference in their pain level and their function level. And by 6 months, people are returning to kind of the activities they were doing before.
All right, so there are solutions. Definitely don't have to live with that pain. You can give them a call at Ortho Neuro, schedule an appointment. All that information up on screen for you. So, doctor, thanks for being here.
Thank you.